My name is Bill Kisseberth. I'm a veterinary oncologist at the Veterinary Medical Center.
My name is Dean Lee, and I'm a staff physician at Nationwide Children's Hospital in the bone marrow transplant program. My role for both institutions is to lead the cell therapy program, which is a joint institution program between the two to deliver cell therapies to patients. The project we're working on is how to give NK cells to a patient in the middle of their therapy. The NK cell name comes from the fact that they're called natural killers. This natural white blood cell in your body that could recognize and kill a cancer cell without ever having seen one before. Like they just know what cancer looks like. But when you get cancer, they happen to be low in number for most cancer types and are not really quite working right. The cancer itself develops ways of suppressing NK cells, so it further knocks down your NK cell function. And then NK cells are extremely sensitive to chemotherapy and radiation. So the very thing that we give to try to cure cancer kills the very thing we have that has a natural ability to kill cancer. I had a graduate student that really wanted to study these cells in dogs, and it turned out to actually really work. We were able to identify them, able to figure out a way to grow them. And if we can grow them, then it was just a matter of what's the best way to deliver them and see if they work.
My patients, my feline and canine patients, can contribute to the development of better treatment for people. Many of the cancers that we see in cats and dogs are, for all intents and purposes, identical to those in people, at least at the level of how they look under a microscope. In the process, when we investigate new therapeutics in our pets, we're actually able to benefit our pets getting access to new therapies for them before they're even available to people. So it's really a win-win situation.
Dr. Kisseberth might say that it will benefit patients because his patients are already the dogs. So we're hoping it benefits them. We're hoping that the findings that we have here on how to deliver the cells and when to deliver them and what they do for metastasis will help us then figure out the best way to deliver them in patients as well, and when we give them, how we give them, and what to expect from them in their delivery.
The opportunity to have Pelotonia Funding to sort of generate the data to say, yeah, this model really helps, really works, is very powerful for us.
There's lots of outside foundations and of course the federal government. There's grants that are available. Funds are limited and highly competitive, and they tend to go much more to well-established ideas that have lots of preliminary data. The Pelotonia funds obviously require a good idea as well, but they give you that head start of developing something that could blossom into something bigger.